All right, I see it's recording. Thank you. Okay. Okay, Rick. Oh, it's Ramon. Okay. All right. So for tonight, who wrote last? Who
I'll
wrote
take
Patrick?
Patrick.
I admit I did them last one.
Yeah, Scott just said he'd take it. Thank you, Scott.
Terrific.
So we'll convene. The meeting is being recorded. Anything to add to the agenda, Rick?
No.
Oh, that's great. All right, and approving, anybody have any issues with last month's meeting minutes? I'll go around the table. Scott, do you have any issues?
I have no issues.
Tom?
No.
Pat, you wrote them. Do you like them?
Whoever rewrote them for me did a great job. I approve.
helped you out a little bit.
Thanks, Rick.
All right, so it is 6:03, and we have 3 hearings. Looks like 1 septic permit, and then there's a discussion. And so we have, do you want to try to do Ramon? He's not on these, right?
6:05 he was, because we had continued that hearing.
Oh, so he is on for 6:05. Okay. So, but we want to wait until 6:05, or can we start now with that?
We would need to wait till 6:05 because we had opened a hearing and continued it to that time.
Okay. So Ramon, just another 2 minutes.
And if we can take care of the septic permit real quick, that one's
Yeah,
fairly
sure.
easy. It's for 51 Farron Road. And that permit had been issued on September 11th of 2017, expired 9/11 of 2020, and they've requested the 1-year extension that Title V allows, which would make the permit good until 9/11 of 2021.
Okay. All right. So it's just a renew. There's nothing to.
No, motions that are needed, no variances. So as long as you guys are okay with the extension, I'll issue that permit.
So again, there's no vote needed, right?
Nope.
Okay.
Nope.
So does anybody have any issues? Patrick? Any issues with this? Scott
None.
shaking his head. Tom, any issues?
No.
No issues.
Okay. All right. So you're set, Rick, to go out and with the extension. And it is 6:04. Boy, that was a long minute.
Hey,
Okay.
guys, thank you very much.
That's Scott McCusick, who was the owner of 51 Farron Road there.
Appreciate your help. Have a good
Oh, Scott. Yeah, I see that. Okay. You take care. And then there's a, okay, 6:05. So 348 Ringe Turnpike. And we have a Patrick Wood on. Patrick, are you here for the 6:05?
No, I'm here for 7 Bridle and Winding Cove at 6:10 and 15.
Okay, well, all right. So we'll start with the 6:05. And Rick, do you have some new information on this, right?
I did, yeah. So I did hear back from Debbie Phillips. So I had spoken to her right after our meeting, and she asked me to just put everything in writing and kind of provide her with a chronology of events as far as the original passing Title V all the way through to our most recent meeting last month. So basically what she came back and said is she did quite a bit of work on this and asked around her colleagues. And basically she doesn't see any avenue where the Board of Health could issue the certificate of compliance without losing the ability to go back and require that new well be finished, or they find some water supply that's acceptable. So she said there's 2 options to move forward. One would be basically to allow him more time informally to get the funds necessary to comply with the permit and plan that you had approved, and that could look however you wanted it to. So you could ask Ramon to come back periodically and check in with the board. You could have me do that on your behalf. Basically you could provide him more time to get that other well up and running, or find some other water source that would be acceptable, and just choose not to enforce the compliance issue. The other option would be to issue some sort of an order that would allow you to provide a date that you would be looking for compliance to be reached by. And as part of that order, you could also put conditions that would take care of your concern with regards to the periodic testing of the well. So how often you would want them to look at it, what parameters you would want them to look at it. You could put any conditions you wanted in the interim. And that's really the only way that she saw that this could move forward to get there without presenting some other thing. So the other option she gave was you could choose to continue this hearing for another month, give the Colazos a chance to get together with their engineer to figure out if there's some other way where compliance could be gained, or at least compliance could be gained to the point that the board felt comfortable issuing certain variances that would allow you to issue that certificate of compliance. But her concern was that if you issued that certificate of compliance, you essentially lose all leverage to require them to finish that well, and you'd basically be saying that things are in compliance as is with the existing well and the new septic application.
Okay.
Mike, can I ask a question?
Who's that?
All right, can I ask a question?
Scott.
Yeah, yes, go ahead, Scott.
So, Rick, I get the first one, of course, essentially give them more time to complete the whole project to the point of certificate of compliance. The second option, issue an order. Can you just run that one by me again? What was the second?
So basically, the septic system is in, the existing well is still serving the house, which creates a compliance issue. And so her thought was if the board didn't want to just go with option one and basically just allow them additional time to do it, and obtain some sort of control as far as what might happen in between then and now, then the only way you could do that would be to issue an order that would have the same requirement at the end, that they gain compliance by citing a potable water source in compliance with Title V. And in the interim, they test the well every 6 months or whatever it might be for parameters A, B, and C. And then when we get to the date that you guys had specified that they needed to reach compliance by, you could revisit it at that date and either choose to extend it, enforce it, whatever you want to do with it at that point.
All right, so can I say back in my words so I know I have it?
Sure.
I think the difference between the two would be the second one is we write language in it like we had asked prior, test every 30 days. And both of these things have essentially an end date. So the second option, we write the same language we've been talking about. And then when it comes to the end of that, I think we still could extend it if need be.
Yeah, so I guess they're very similar in how they're made up. It's just one is an informal agreement, one is more of a formal agreement.
Okay. And informal being, we're just gonna, the first one, we could extend our deadline for this thing and ask that you please do this, which is informal, as opposed to an order where we say, this is mandated with this completion date.
You got it. Yep, exactly.
Okay, thank you.
So it's really, we're sort of on all of this, we're doing good faith, on trying to figure out when I'm not sure where that noise is coming from. Do you guys hear that?
That was
No.
me
Yes.
banging my head against trying to learn this.
Okay, so it's really good faith remote. We're trying to help him out. He's got a frac, and it was going to be another 3,000 to 5,000, which he didn't have. So we said, let's see what happens month to month and do the testing. So we're all happy with that. So it's really, I guess, the reason we wanted to meet monthly is to say, Ramon, how you doing? And does it look like you're going to have a cash flow that you would be able to do do the fracking in the near future? 30 days, 60 days, 90 days? Is
Well,
anything?
so my goal is to have this done by this summer. Um, so I don't want to go into next year trying to get this done. I just don't want to do that.
Yeah.
So my
Okay.
goal is to have it once we have, which I need to have, the septic system is in, but there's still a little bit more work that needs to be done. I want to get all of these guys in here late spring, early summer to complete all the work that they need to finish here and do the well as well also. So my goal is to hit it and really get it done by the summer. So I'm only asking for, a few months of an extension. Um, I don't like where it's at right now. I've always thought that it was an issue having it that close. So I'm going to continue, it with the project and complete it because quite honestly, I'm almost 10,000 into it and the system is, I could see the finish line. So
Yeah.
we just need to get it done.
I thought the septic system was done. Is
The
that not?
septic system is done. They just
Okay.
need to do the landscaping around it.
All right. And it's functional, right, Rick?
Mhm.
Okay.
Yeah.
Vermont. So
Yeah, so
Yes, it is.
Title V, that requires that you have your erosion control barriers. So usually we take that to mean loam and seed. So we had talked about that, it really wasn't the best time of year to do that. And that would wait till the spring, regardless of how this all went.
Yeah. So that's why we have you come every month. So I guess a couple options for the board is to continue as we're doing, and now, we need to hear this time. That's the first time we really heard a timeline, I think. You might have said this last month, but, we're in February now, and you hope in July or August, to me, that summer, that you like to complete
Mhm.
this. The only, okay, so based on that, I would go around the board. Do you want to continue the way we are? Because as Scott, had the Rick detail, one's a formal and one's informal. And on both of these, we could set dates, but whichever way we go, we can change those for the future. If we went formal now and he didn't meet the date, we could move the date again. If again it looked like he was going to get it done. So I'm going to go around. I guess my opinion would be let's go another month or two, to sit and see where he's at. Because in 2 months, it's March, end of April. He's within a couple months of July and August. Ramon would have a better idea of cash flow. So that's my opinion. I feel like we should just continue the way we're doing it. Scott, I'll go to you first.
Yeah, Glenn, just remind me, or Ramon, anybody, I'm sorry, what's our handshake agreement today with testing and things of that nature?
I do the testing every 6 months. So we had it done around the November timeframe. So it's due around April, which is fine because I usually do it in the spring and then again late fall.
Thank you.
All right. And your opinion based on that?
Yeah, I mean, I can make a motion if you want. I mean, I'm good with if an extension. I think we have to agree to a time, right? But in our current agreement.
Yeah. Another thing I would ask, person, and Tom and Pat, I'll get to you. For Ramon, is this okay if you just call each month? Because as Rick just said, it's an informal agreement. We know you're testing. Rick could just check in with you. Do you mind sitting in for, next month and the other month? Or are you okay with that?
No,
or?
I don't mind.
Okay. All right,
Yeah,
so
I'm okay with that. Like I said, my goal and our commitment is that we should have the funding available by the June, July timeframe. It's whether or not the contractor is going to have the availability to come back at that time. So I don't want to engage him until I actually have the funding.
Okay.
Okay.
All right. Tom, can I hear your opinion on this?
No, I'm fine with Scott's proposal.
All right. And Pat?
I'm fine with the proposal. Actually, the only thing I was wondering is, do we really need to have Ramon come back every month? Could we just
That's
have
what-
them come back?
yeah.
Yeah, I was
Yeah.
I was
3
looking
months.
at our April meeting, which would be April 5th. So maybe you'll give it a couple of months. I don't think much is going to change in
No.
1 month, but maybe I'll have a better idea.
And like
of
you
what-
said, Rick is staying on top of the project
Yeah.
anyway.
Okay,
So if there's anything that changes drastically, Rick could let us know.
all right. All
But
right,
what if we say is next time we want Ramon, let's look for him in either April or May.
yeah, and just move forward with the existing informal he's doing the testing.
Yeah,
Yeah.
Rick keeping us
Yeah, but-
updated.
All
By
right,
I
that
think we have to
time-
extend it to a certain point. Like, I would propose 6 months. That gets you into the July timeframe. That kind of is what you've been talking about, Ramon. If you were so kind and came back and just gave us a heads up after your April testing, I think it would make everybody feel better.
Yeah,
Yeah.
absolutely. You know what I'll do is when we do the testing in April, I'll send a copy of the results to Rick.
all right. So based on what, so Scott, did you just say not even April, just give him 6 months from now?
Yeah, well,
Yeah.
I mean, he's not gonna have funding till July timeframe. 6 months gets us out through July.
And we
Yeah,
get the
February,
testing.
March, April, May, June, July. So
Yeah,
that it seems to all align, and then we're
I
not
think so.
talking about, we're gonna get updates on, there's nothing to get updates on, right? I mean,
Okay.
he's not,
Okay, I'm good with that. Pat, are you good with
I'm
that?
good with that.
And Tom, going out 6 months, and then we'll see Ramon. And again, we have Rick who's speaking with Ramon, and we'll get the test results in April, and we'll have those at the meeting.
Right.
And okay, Ramon, I would ask you as a homeowner, are you good with that? And we'll see
I
you in
am.
6 months.
Yeah.
Again, Rick will have his conversation with you. We'd like to get your report in April and see what that is.
Sounds good.
Okay.
hey,
Sounds good.
Rick, so that we can vote on something, can you pick a date? I can't imagine we just extend 6 months because I'm sure we're already past the time, right? So,
Yeah, so I guess, my thought would be, based on what you guys just said, he typically does the testing in April. What if he came to our meeting in May, which would be May 3rd, to
Sure.
present the results of the well testing and kind of check in, and then you guys can go from there. But that's at least 3 months out, so hopefully he's got a better idea, and the board can kind of see where that well stands at that point.
Sounds
I'm
good.
I'm good with that. Everybody, Ramon, you good with May? First
I
week?
am.
Okay, good.
right.
So do we need to vote on this? Okay.
No, so the only question I would have is, we had opened the hearing last month. We continued it to tonight. It doesn't sound like, based on Debbie's opinion, that that's really an avenue that would work out, and we're taking a different route. So if you feel like there's a need to continue it again, then you can. But it doesn't seem like that's going to be an avenue unless Ramon wanted to go back to his engineer to see if there's another way to resolve this.
so, but I must be thick tonight. I apologize. Rick,
No, I'm feeling the same way.
So I think what we would like to try to do is go with the first option that Deborah was saying, that we not continue, but we extend the deadline to a point in time, if that's May
Yeah, so it's
3rd
based.
or
it's
July,
basically-
something.
So, based on what you guys just said, you wouldn't choose to take any potential, enforcement because of the non-compliance issue until August. That's when you're going to revisit it. So you're basically, you've got a handshake agreement that you aren't going to do anything until August and give them that time to try to come into compliance. So the issue that I'm talking about is, because you had opened a formal hearing to consider the variances for the reduced offsets from the well to the leaching area and the well to the septic tank, it doesn't seem like there's, any avenue based on town council's comment that we should continue down that path. That option one of just giving him, more time informally seems to make the most sense, and that's what the board wants to do. So, I would suggest, unless Ramon wants to keep it open, that you close this hearing and we just continue on with the handshake agreement.
Okay.
Okay, I make a motion that we close this hearing.
I second.
All those in favor say aye. Scott,
Scott says aye.
Tom,
Tom says aye.
Patrick.
Patrick says aye.
Okay. Glenn Hathaway, aye. So we're closing the hearing. Thank you. All right. Rick?
And then, so do you want to vote on those variances or just say, continue with no action? I think it makes more sense to say continue with no action and not make
That's
a
what I would
formal
think.
decision on it.
That's what I
Continue.
thought. I thought that's what we're
Right.
doing. So continue with no action.
Yes,
So
continue with no action.
no vote required on that, right?
No.
Okay.
Okay.
All right. Scott, you okay with that?
Thank you.
I am.
Sounds good. Tom's okay. Pat, you're okay? All right.
All right, so basically I'll send Ramon, Zoom info, for that May 3rd meeting. And, hopefully at that time we can look at the water results that come back.
All right. Sounds good. Ramon, do you have any questions?
I do not.
Sure. All right. Sounds good. Thank you very much for showing up tonight, and good luck with your contractor there and getting the funding. So,
Thank you very much. I appreciate it.
all right, you take care.
All right, take care.
We'll see you in a few months.
Thank you. Bye-bye.
All right, Scott, are you all right with the meeting minutes for that hearing?
Yeah, I hope so. Okay.
All right, Rick will back you up on it anyway. So we have a 610. We have 7 Bridle Path. It was 623. So I think Patrick was here for that. Patrick Wood. So
Hey, guys.
hi Patrick, how you doing?
Good.
So 610, 7 Bridle Path, septic variance. Who wants to bring, Rick or Patrick? Who wants to present it?
Yep, so just give me 1 sec, I'll pull the plan up, and then Patrick, if you just want to present what you're asking for.
And Rick, there is a letter of variances, I assume, to reference.
There is, yeah, so stated January 12th, 2021. Oh, Glenn, can you make my account
Yeah.
a co-host? It's the
It's R Metcalf, right?
Yep.
Okay. Okay.
There we go.
Yeah.
All right, so that's the lot there. And Patrick, if you just want to go over the list of variances that you're looking for.
Oh, yeah, it's just a local upgrade approval for an existing lot with a failed septic system. We're looking for variances, including, well, the local variance is just the plan was drawn at a 1 to 10 scale. Minimum of 2 deep observation holes. We provided 1. There just wasn't enough real estate in the backyard to get 2. You'll see 2, but one of them provided really only sewage once we got down about 3 feet. So we poked another hole the best we could in an area outside of where we thought the existing system would be. So we have that. We requested a variance to the property lines and 50 feet from the drain line. I think we're maybe, I can't see it right now. I'm not sure how far off we are from the property line, but there's you might be able to see it. There's a drain line that kind of comes right out the back of the middle of the house, and it goes through the proposed system. So we're routing it outside of the impervious underground barrier that we have as far away as we could into the backyard. The other variance we're asking for is the separation to high groundwater. We are providing 3 feet for that. So those were the variances.
So it's
Okay.
basically your code require, or your regs require 1 to 20 scale. You provided 1 to 10. Title V requires 2 deep test holes, provided was 1. Edge of system 20 feet from the foundation, provided was 16 feet. Septic tank 10 feet from a property line, 4.5 feet provided. And leaching area 50 feet from a drain line that intercepts seasonal high groundwater, provided is 8.7. And then the groundwater offset was 4 to 3 feet.
And what is this job? Is this a renovation or just a replacement of system?
No, it's, I think they just know it's time to fix it. I suspect they're probably pumping out more than they want to, and they know it
Okay.
needs to get done.
Okay. All right. Rick, any objections?
So I think all of them are pretty typical, and I should say, just so you've got it in the minutes, Scott, that we do have all the green cards for the abutter notifications for this. So the only one we don't typically see would be that drain line, and it's coming off of the house. So is that? Do you know what the drain line's for? Is it just a curtain drain to lower groundwater? Or,
I think it's hooked up to the sump pump in the basement.
okay, so it's more discharging than cutting water out of the ground and bringing it somewhere else.
Yeah, exactly.
Okay. All right. Yeah, so I don't see any issues with what he's proposing. I've got no problems with it.
Okay, I'll go around the table. Patrick, do you have any questions or concerns? All right.
None.
Scott,
Nope.
Tom?
No, I do not.
All right.
All right. I'll make a motion on 7 Bridle Path to accept the variances in a letter dated January 12th, 21.
I second.
All those in favor say aye. Okay, Patrick,
Patrick says aye.
Scott,
Scott says aye.
Tom,
Tom says aye.
Glenn Hathaway, aye. So you were passed. Rick, do you need anything from you need money to pay for this? Checks?
So it looks like they'll still owe permit fees to Neshoba and to the town. So once I get the permit up to Ashburnham, I'll give them a call and let them know that those fees are still due. And yeah, Patrick, if you want to pass that along too.
Will do.
All right, so you're all set. Patrick, thank you very much.
And he's got one more
He's
for
Winding Cove as well.
48 Winding Cove.
All right, so 6:15, we got a 48 Winding Cove Road. Rick, is there a plan you want to bring up?
Yep, I'll bring that up. And there is a variance request letter. It's dated January 20th, 2021.
Thanks, Rick. It's another similar local upgrade approval. Existing house, it was more of a seasonal home, and they just purchased it maybe last year. They want to live in it maybe more often than seasonal now. So there's an existing system. It's failed. I don't really know the history behind it. That's kind of an approximate location right between the house and the shed. So there's a septic tank there now, but with the higher groundwater, we had to kind of push the new location of the septic system a little bit further down and put in a pump. And we have the leaching field kind of in a wooded area right now. This has gone through the Concom already and has gotten approval. We've made changes since the Concom approval. We've actually moved it further towards Winding Cove Road. We were initially going to design it as enough for 3 bedrooms, but then looking at really the feasibility of upgrading it someday in the future to totally Title V compliance might not even be possible. So the owners decided I think we were just going to keep it as a 2-bedroom system. So we pulled it further toward the road and took out one of the lines anyways. But this is what we have here. It's just a bed, and we're seeking variances for Obviously, 100-foot variance from the lake, Sunset Lake in the back, we're provided 76.9 feet, as opposed to 100-foot required. Again, the plans are drawn at a 1 to 10 scale as opposed to 1 to 20. Another 1 foot reduction in the groundwater. So we're providing 3, required 4. And a reduction in the required 12-inch separation between the inlet and outlet of the T's. So the lowest outlet is on the tank, and the pump tank, I'm sorry. And we're providing 1 inch so that we can keep that as far away from the lake as possible.
That it?
Do it.
All right, Rick, any concerns here?
No, there's really not much area on the lot to get away from the lake. And you can see that there's quite a bit of grading that's associated with it. So without getting into your retaining walls and other ways to kind of reduce grading, I think it's the best option for how the lot exists.
All right. I'll go around the table. Scott, do you have any questions?
Other than other green cards on file for this as well?
Yes. Yeah.
Yeah, thank you.
All right.
No, no
Tom, any questions?
No.
Patrick, any questions?
No questions.
All right.
Okay, make a motion for 48 Winding Cove Road to accept the variances as outlined in the letter dated January 20th, 21.
I need a second.
I second that.
Okay. All those in favor say aye. Patrick Durkee,
Aye,
and your name?
Patrick.
Because it's recorded, you can say that. Okay. Tom.
Tom Flanagan says aye.
Okay. Scott.
Sibley says aye.
All right. Glenn Hathaway. Aye. All right. Patrick, you're all set.
All right. Thank you, guys. Have a great night.
All right.
Thanks,
Sounds good.
Pat.
You too. Thank you.
All right. All right. We already did the septic permit discussions. I don't see any other correspondence. There's a request for an annual report.
Yeah.
What's that?
So, every year we write the annual report that goes in the town annual report. So I've done that for you guys in the past. I'd be happy to write something again. We've had a pretty busy year, so I don't think it'll be too hard to come up with things to list. But
right.
I'd be happy to do that unless you guys want to.
Anybody else want to do that?
Negative.
Negative.
Sibley does not want to do that.
All right. All right. Okay, so there's no other, I'm saving the COVID to the last. So I don't see any other correspondence. So for discussion, anything else, Rick? I'm going to hit the COVID.
So the only other thing is just a question to you guys. How do you want to handle something? It looks like the Daily Grind, which is the bagel shop next to the town hall in the Ashburnham market, has not renewed their food license. Bridget's been in contact with them several times and we just haven't gotten any response from them. So she was wondering how you want to handle it, whether you want or not, you want us to send them a letter calling them into a board meeting, or what you'd like to try to do to resolve the licensing issue.
Yeah, I'm just surprised. I mean, that's one of the things he has for customers coming in.
Can you send the letter requesting clarification if they're going to want to renew their license or not?
I believe we've already done that, but yeah, I
Okay.
can send something to him. I mean, I've got Dave Hearn's email and everything. I'm not sure how Bridget's tried to contact him. Every year he's late with this, so it's not
Okay.
like it's irregularity. But
Gotcha.
usually he'll at least have responded by now.
All right. So is it a friendly reminder via email? Is that?
I mean, so, we've got a month to take care of it, so I can try to get it done. And if not, and we're not getting anywhere, are you guys okay with us sending them a formal invite to our next month's meeting?
Yes.
Yeah, I agree. I think that's the right thing to do.
Yeah, that's if you don't get anywhere with just a friendly prod.
Yeah.
Okay.
Yeah. So one more time.
Okay.
All right. Do you want that in the meeting
Thank you,
minutes?
Rick.
Yeah, if you could, please.
All right. Scott, you all set?
Yes, I am.
All right. So COVID-19 update and discussion. Want to give us an update?
Sure. So just go over the case count numbers from the state's reporting. So just to remind you guys, these numbers are reported by the state on Thursdays around 4 or 5 o'clock, and they cover the positive COVID cases in the previous 14-day period. So it's basically a 2-week case count. So when they were reported on let's see, January 7th, we had 44 cases. On January 14th, we jumped up quite a bit to 78 cases. On January 21st, it was reported 79 cases. So we stayed about the same as the previous reporting period. And then the most recent one that came out on January 28th reported 41 cases. So kind of back to what we had been seeing. I think it was around 38 before we went into Christmas. So kind of back to the pre-holiday numbers that we had been seeing. So we are lower. We're still in the red, but it's trending downward. So hopefully we continue to head in that direction.
Yeah,
so
that's
that-
going to be the governor's speech on the Friday that we got through the holiday, what the impact was from the holiday, and everybody's numbers around the state have been going down to what it was before that. So,
yeah. I mean, it was a trend throughout the district where pretty much every town had an increase in numbers that resulted from the holidays, and now they're coming back down. We might see a little jump in cases in the next reporting period. I think there was an issue with the hockey, something to do with hockey in town, but we're dealing with that to make sure that we control that cluster.
okay.
And then so the big question now is the vaccine. So I know Glenn's talked to Jim Griffey, and he's got an idea of kind of what we're trying to do. But as you may or may not have heard, vaccine availability is really the biggest issue right now, and we've been allocated extremely low amount of doses. So we've been encouraging people to find alternative ways to obtain the vaccination, whether it be through pharmacies, max vaccination sites, their primary care physicians. I had posted last week some information that we can point people to. So it's right on the town's COVID portion of their website, and it lists a searchable map for vaccine sites, and just our suggestions as far as who they might want to reach out to get the vaccine. And we're just trying to be upfront with people that there might be other options that they could have, that they're going to be able to get their vaccine sooner than we can provide it to them.
Yeah, the only surprise. So I've spoken to Jim. Was waiting for tonight. Has the number changed? When I talked to him, you had whatever the allocation was, but for the town of Ashburnham for seniors, it was going to be like 10 shots.
Yeah. So we'll be.
So that hasn't changed.
No, yeah. So we'll be running a small clinic tomorrow. We really have chosen not to advertise it just because of the low number, but we've been working with the Council on Aging to try to identify people in that phase 2, part 1 category, which is the 75 plus. So right now, what we're trying to do is to determine what our allocations going to be, because they've basically put a cap on what DPH is going to distribute to the local boards of health, and we're trying to figure out if we can get more than about 100 doses a week, which is what we've currently been allocated. So it's pretty limiting. It's not many at all.
So this was for over 75. So guys, I went online and I contacted the town hall. I said, maybe we only have 10 people over 75. So we have more. So the number of seniors by age range over 75 was 445 in Ashburnham. So, just no one's fault. You've all been reading the news. So there's a shortage, that 20 million shots, no one knows where it went. I don't know how you misplace 20 million shots, but so it's a bit of a mess. So for the 10 that we're getting, we've got 445 seniors in town over 75. So, but we weren't going to be the only avenue for people to get shots anyway. As Rick just pointed out, whatever the state would give us, then we would go out and offer it. So it's all the individual organizations and independent doctors that Rick just said that if someone would ask you, you're on the Board of Health, I guess you're welcome to share that number, right, Rick? I mean,
The only thing that I would say is just because it's such a low number, we obviously can't serve everybody. So, like I said, Jim had been reaching out to the COA to try to identify those people. So, if the numbers became bigger, definitely, let everybody know. But with such a small number, there's still some question as to how we identify those people and do it in a way that's fair.
Yeah.
And it's been tough to try to figure that out.
Yeah.
all right. So, disappointing, but not in you, Rick, or Neshoba, but, for all of us, people just see us as the Board of Health, and the news says, look to your local boards of health.
Well, this is Rebecca Rice, and I'd like
So
to
this
schedule
is-
an appointment for tomorrow morning. If I
pretty
can get
disappointing.
it
Anyway.
around
'em.
12 noon, that would be great.
Tom, you got someone
Ask
talking?
before that.
Okay, yeah, okay. So I'll just go around the table. You've heard the news. So Scott, do you have any comment on that? Okay, no comment. Tom, any comment? Okay, and Patrick?
Patrick has a question.
Okay,
So, Rick, considering the fact that it's such a small amount of doses, would this be considered the Moderna that they're doing? Because
Yeah, so we're using the Moderna vaccine just because we don't have the ability to properly store the Pfizer vaccine. It's got to be stored
that
at that.
freezer that Pfizer needs.
Yeah, so we've got the Moderna vaccine, and that's what we've used in our. So we did first responder clinics last month. We'll do their second dose clinics towards the middle of this month. And then we'll continue on basically with however many doses we get. But that's what Jim's trying to kind of work on right now is getting more, because it's not just 100 per town, it's 100 for the district as we understand it right now. So it's a really low number. And I just had the call with the Department of Public Health today, and they kind of hinted that the role of the local Board of Health is more going to be to serve particular populations that might not be able to get to these mass vaccination sites or to other sites that might be available. And so we're kind of confused about what our role is and what's expected of the local Board of Health, because it seems to change every week, and the state points the finger at the local Board of Health and says, go see them to get your vaccine.
Yeah.
When in reality, that's not really what we've been asked to do. So we're trying to figure it out. And like I said, we'll try to do whatever we can with the allocation that we get. At least initially, it looks like it's going to be some sort of a centralized location. But we are exploring options as far as being able to open up another site or two somewhere within the district to be able to serve people if more vaccine becomes available, or if the need is there.
so to that point, we live in the town, so people are going to ask. So right now, this meeting's being recorded, so it's in record, what's available. How often will they call you to tell you what's available? Because what I heard on the news, and again, it's the news, but the news is getting better. It's getting every week they're finding more resources. Do you, next month, weekly, will they tell you we have more and how many more?
I wish I had that answer, but the
Okay.
answer that we get from the people that would tell us that is it's basically a wait and see approach.
Right.
It really depends on the federal government getting the vaccine and then allocating it to the state. So the state couldn't tell you we'll have X number of doses available on this date. A lot of it has to do with everybody as far as vaccine providers doing their paperwork correctly. So the state gets refills through the federal government when we say that we've administered the vaccines within the software program that they have. So a lot of it is automatic. And if people aren't saying we administered these doses, then the state almost kind of gets penalized because they won't get those doses in return that have been administered already. So, I think it's all new and we're trying to figure out what it is. But I think that, the biggest question at this point is what is the role of the local board of health in this whole vaccination plan? And, at least as of today, they were suggesting that we could do more if we were capable. But the expectation is that maybe we're an option for people that can't get out of town or can't get to these other locations that are available. And the biggest issue is that Central Mass, I don't know if you guys have looked at the map, but North Central Mass is pretty empty as far as options. And you've got a couple in Gardner, but as far as I know, nobody's been successful in getting appointments there. So I think there's a lot of state reps, town administrators, boards of health that are trying to push the state to give us some sort of a if not a mass vaccination site, an option that could handle a substantial amount of people in this area of the state.
It sounds like there's going to be a big push in the next couple of weeks to get the vaccine to pharmacies and that kind of place. So that's probably going to be the major.
What we've been telling people is just to regularly check in with whoever they would typically get their vaccinations through. For the most part, that's their people's PCPs, or it might be the CVSs and Targets and Walgreens. But
what you're talking about, Rick, is the people who you were saying looking for alternative sites. You're talking about basically that first stage of people in number 2, the 75 and older.
That's what they're talking about right now, is be able to help out with those. And then the affordable low income senior housing is what comes next. And they were talking about possibly partnering with those type of groups to be able to vaccinate them. Jim Gariffi's doing most of the planning as far as the vaccination. So I'm not sure, if any have reached out or we've reached out to them. But like I said, it's really, we've got to get our role defined, and we'll vaccinate whoever we think we can, and provide the service, as much of a service to the residents as we possibly can. But there's still quite a few questions that need to be answered as far as what we're going to get to be able to figure out how we might be able to do that.
So we've got 4 weeks before we meet again. As the TV news ramps up about more is coming. I thought hopefully, maybe you had better news tonight, but it's not, and you don't know, right?
What I can say is that there's a hope that by the beginning of March that the availability of vaccine will become more robust. But there's just, there's nothing that is written on paper that says, we're going to start getting a significantly more amount of doses. It's we hope that it will be.
I mean, one thing we have to say to our townspeople is that, for Ashburnham, for the state of Massachusetts, as a town in Massachusetts, when they allocate to local boards of health to Neshoba, they, can we call someone? Are we all being treated equally? I mean, people are going to ask that. So how many towns do you handle?
16 plus Devon's.
Okay, so at 16, you were given a couple hundred shots, and then you looked at the population and decided Ashburnham would get 10 based on population. Is that what happens?
Yeah, so I think some towns might have gotten 12. I think was the most that any particular town got, but for the most part, it was 10 doses per town.
All right, I'm just asking this because the other board members are here. We're trying to tell our our community what's going on. So this really isn't good news. We were kind of hyped that things were happening, but it's happening pretty slow. I know by beginning of March, it's February 2nd today, right? I mean, that's again 4 weeks away. As stuff happens, we're going to hear it on the news, but obviously you're going to send something to us. And Jim said basically, when you hear stuff, you send it out. So right now we're going to end this meeting. We really don't have anything. We hope that by March it's more robust. There's no number. There's no where we're going to do it. But one thing that Jim had said to me that was sort of the glass half full is that even with this small amount, at least we're figuring out things we haven't done before and how we get the shots in the arms. So, right, so you're learning a little bit something from this, even though it's only a few doses.
Sure. Yeah. And, the other part that you've got to remember is that it's a 2-dose vaccine. If it was a 1-dose vaccine, it would be a lot easier to administer, but you've got to, for every person, you need them to come back twice, and you need the staff to be able to, run 2 clinics for a single set of people. So it's a lot to plan for logistically, and the hope is that, and the Department of Public Health people said it today, is that Johnson and Johnson vaccine will receive their emergency approval at some point in the future, and it will.
That's the 1 dose, right?
The 1 dose, yeah. So it'll make the administration portion of it, and being able to really just get to more people, and another vaccine that's available to us, which would increase our allocation, more than likely. So hopefully that comes along and helps us out in the process of being able to get to everybody.
All right, I'll just go around the board,
We
around
can
the
only
table.
hope.
Patrick, do you have any other questions about COVID-19?
No, I've heard enough good news tonight.
Yeah, okay. Well, I guess it's really no news, and that's too bad because,
Exactly.
not Rick's fault, but, I guess I'm personally surprised.
We're not blaming on you, Rick.
Well, yeah, tell Jim it's his fault. But, I'm just surprised because
Yeah,
the news
Jim's not here. It's his fault.
I'm surprised we don't have more positive news. And I guess, it's only been all of a week with a new administration in and a team that's sort of working. So I guess we have to look at that. Everybody, there have been some surprises. We're all hearing the same news. So well, hopefully it's going to get more.
Yeah, I mean, the news isn't great right now, but the hope is that, as the states told us that they plan to roll out more vaccination sites, the hope is that there are going to be a few that pop up in our general area, and the state has even come out and said we can open up a lot of sites, and we might have empty seats there until the vaccine's available. But if they continue to do that and have sites available to people that geographically make sense, then once it becomes available, then we can really ramp up our efforts to try to get people vaccinated. And we're just not quite there yet, but hopefully we will be, and that comes shortly.
All right, Tom, any questions, Tom? Any other comments?
No, I don't have any.
All right, Scott?
No, I want to thank the show that you're trying, right? It's, 10's more than I'm hearing anywhere else, to be honest with you. So, I mean, I guess my glass is half full on that. I haven't heard of a shot anywhere. So the fact that you even have 10 is take it for what it's worth. But
well, one thing that Rick brought up, and we talked about, I think last month, first responders in town have gotten their shot, the first shot. So those are the guys that are going to rush into the house at 2:00 in the morning or automobile accidents. They've got their shot so that they're protected. So that, we should be sharing with the community at least that's happening.
That's good. That's good.
Right. So, and Rick, and that is what, police, fire, EMTs, all that,
Yep.
right?
Yep.
Okay. So that really is good news, because those are guys are going to.
Oh, it is.
We don't want to jeopardize those individuals and their lives. Okay. So there's a glass half full. I don't have anything else. I've gone around the table. Rick, do you have anything else?
So just the one thing is just a reminder that when Jim sends you those emails, Glenn, they're only going to you. They're not going to the other board members.
Yep.
So if you want to forward them on to the board members, then I would suggest that you do that. The only thing, just you can't talk amongst each other, so you can distribute information. You just can't deliberate about it.
Okay. All right. Sounds good. All right. Scott, we're ending at 6:55.
you got it.
We're done. Thank you very much, everybody.
Hey, don't forget your reminder to stop recording.
Yes, I'm going in there right now.
Great seeing you guys.
Good to see you
All
guys.
right. Have a good night.
Take care.